Hi, I am Professor Ali Seven, consultant in obstetrics and gynecology. Over the years, I have had the privilege of supporting thousands of women through all stages of reproductive health, from routine care to complex conditions. Today, I would like to talk to you about a procedure that many have heard of, but few truly understand until they face it themselves, and that is hysterectomy. So let's begin with what it actually means. What is hysterectomy? A hysterectomy is an operation to remove the womb or uterus. In some cases, we may also remove the cervix, fallopian tubes or ovaries, depending on your individual needs and medical history. There are different types. A total hysterectomy, where both womb and cervix are removed. A subtotal or partial hysterectomy, where the cervix is left in place. And a radical hysterectomy, which includes removal of surrounding tissues and is usually carried out for certain types of cancer. We may also remove the ovaries and tubes if clinically indicated. This is known as a hysterectomy with bilateral salpingo-oophorectomy. Why might a hysterectomy be needed? Hysterectomy is never our first resort. We consider it when other treatments haven't worked or when the condition is too advanced to be managed conservatively. Some common reasons include heavy or persistent bleeding unresponsive to medication, fibroids causing pain or pressure, endometriosis, uterine prolapse, chronic pelvic pain, and early-stage gynecological cancers. What are the options? There are three main techniques we may use, and each has its own advantages. The best approach depends on your medical condition, body structure, and previous surgical history. First, abdominal hysterectomy. This involves a larger incision across the lower abdomen. It may be necessary in more complex situations, such as very large fibroids or extensive scar tissue. Second, vaginal hysterectomy. In this method, the womb is removed through the vaginal canal with no need for external cuts. It's often used in cases like prolapse and generally allows for quick recovery. Third, laparoscopic hysterectomy. This is minimally invasive approach involving several small incisions in the abdomen. We use a camera and fine instruments to carry out the operation. It usually results in less pain, smaller scars, and quicker return to normal activities. Each of these methods is safe and effective when chosen appropriately. My role as your surgeon is to recommend the best option based on your specific circumstances. How do we prepare you? Preparation involves a full assessment, including blood tests, imaging, and sometimes a biopsy. We will also have an open and honest conversation about the procedure, how you are feeling about it, and any concerns you may have. Because this isn't only a medical event, it can also carry emotional weight. For some women, it may raise questions about identity, fertility, or intimacy, and it's entirely normal to feel anxious or uncertain. We are here to support you, not just medically, but as a whole person. Recovery and aftercare. Most patients stay in hospital for 1 or 2 nights. With keyhole or vaginal surgery, many women are back to light activity within a week. Full recovery tends to take around 4 to 6 weeks. If the abdominal approach has been used, it may take a little longer, around 6 to 8 weeks. We provide detailed aftercare instructions, follow-up appointments, and emotional support throughout your recovery. Frequently asked questions. Will I go into menopause? Only if the ovaries are removed. If you leave the ovaries in place, you will continue to produce hormones, though your periods will stop. Will this affect my sex life? For most women, there is no negative impact. In fact, if pain or bleeding had been interfering with intimacy, many find that their quality of life improves after recovery. Of course, it's normal to need time, emotionally and physically, to feel ready again. Will I feel different as a woman? This is something I hear often, and the answer is no. Your femininity, identity, and worth do not depend on your womb. Most of my patients feel a sense of freedom and relief after the operation. Is it risky operation? All surgery carries some risk, such as bleeding or infection, but serious complications are rare. We take every precaution to ensure the procedure is as safe and smooth as possible. As you can see, a hysterectomy is a major decision, and it's completely normal to have questions and emotions around it. Whether performed via open, vaginal or laparoscopic technique, the aim is always the same: provide relief, improve quality of life, and support your long-term health. Take your time to explore your options, ask all the questions you have, and make decisions that feel right for you. What matters most is that you feel supported, listened to, and safe every step of the way. Thank you for watching, and please don't hesitate to get in touch if you would like to know more.